Recovering from knee surgery is highly variable.
It was going to take forever to get better if I was ever going to get better.
There's got to be something out there besides a CPM machine, which clearly isn't helping me.
Active and aggressive with this thing, or I was going to need
I'm a guy that's not looking to relieve the pain. I'm a guy that's looking to get back in the game.
That downtime was not what I wanted.
We've spent the last 7 years perfecting the recovery system that takes variability out of knee rehab, so you can quickly get back to your life.
Welcome to The Bee's Knees, a podcast full of articles, interviews, clinical studies, and advice about knee surgery, physical therapy, and life after knee surgery. This week on the Bee's Knees podcast, we have an article written by registered nurse John McKay entitled, Want to Live Longer? You May Want to Start from the Ground Up, read by Carl Mina. Be sure to visit the webpage for this episode, as there are research references and some useful charts that support the findings here. From the moment we take our first health class in elementary school, we are taught how to take care of our bodies to live a happy, healthy life. We all know the basics. Drink plenty of water, eat your fruits and vegetables, and get outside for some cardio a few times every week. Of course, all of these things are important. But there is another major indicator that is key to longevity that many people don't know about: leg strength. The advancements our medical community has made is nothing short of remarkable. We have medications, surgeries, and therapies. These can cure or treat almost every injury or disease Mother Nature can throw at us. But outside of taking a pill or having an operation, an increase in leg strength can increase how long you live as well as your quality of life as you age. Helping my patients live longer. As an RN and recovery coach, I see firsthand what is possible in regaining strength, and what happens when the cascading effect of the lack of mobility start to add up. A few years ago, I worked with a CHF, congestive heart failure, patient in a nursing facility. This patient fell down and broke his hip as a result of poor leg strength. This began a series of negative health events for him. He lost even more strength as he attempted to recover from the hip. This leg muscle weakness meant that he was not able to move adequately to pump the swelling and blood that, under normal circumstances, would circulate throughout his body. One health challenge can be compounded with another, and it became increasingly difficult to rebound. It was sad to see the accelerated decline of a person who might have otherwise had many more years of normal activity. Measuring strength and fat mass. A 2010 study set out to find the correlation between muscle mass, muscle strength, fat mass, and physical function. The study included 1,280 adults over the age of 55. In the study, it was found that the leg strength and fat mass were equally the best predictors of physical function and mortality in older adults. This may seem surprising to some, but the stronger an individual's legs are, the more likely they will be able to participate in cardiovascular activity, hence improving overall health. Looking to get into better overall cardiovascular health? The result of this study suggests improving your leg strength would be a great place to start. Now let's discuss falls. Unfortunately, falls are a serious issue as we age. Of course, environmental hazards like a rug or a cord pose a risk for individuals to trip and fall. But more often than not, falls are caused by personal risk hazards. Of these factors, the two largest risk factors are leg weakness and poor balance, which is typically prefaced by weak leg muscles. Many individuals with these risk factors may also have other comorbidities that would make recovering from a fall far more difficult. So, not only do weak leg muscles make it more likely that someone will fall, it will make the recovery from that fall far more challenging. This is a perfect example of why X10 patients have such great results when they're able to strengthen with our rehab program. Quadriceps strength. One study that focused on the loss of quadriceps strength after knee replacement, TKA, found a 62% post-operative decrease in patient quad strength compared to before surgery. This is the reason behind prehab. Every patient will experience a loss in muscle strength and flexibility after surgery. However, the more strength and flexibility one is able to add prior to surgery, the better off they will be after surgery. Muscle Mass to Live Longer, a new study. Finally, and perhaps most surprisingly, just last year a study was published showing the association of muscle mass, strength, and all-cause mortality with adults in the United States. The study followed 4,449 individuals all over the age of 50. The results of this study found that low muscle strength was independently associated with an elevated risk of all-cause mortality. This includes metabolic syndrome risk factors. Metabolic syndrome risk factors include high blood pressure, high blood sugar, and abnormal cholesterol levels, which all increase the risk of stroke, heart disease, and diabetes. In other words, a patient's muscle strength is a good indicator of how long they will live. This is regardless of an individual having any of these other risk factors, so be sure to get that strength training in. Learning to take care of ourselves to live longer. This research demonstrates the critical role leg strength has not only in our day-to-day lives, but in planning for happy, healthy lives in years to come. These results show how important it is to build strength and take care of ourselves. Happy strengthening!
I'm Dr. Justin Trosclair, host of two-time Podcast Awards nominated A Doctor's Perspective podcast. I interview doctors in and out of my profession about their specialties and the occasional non-doctor special guests. But we also go behind the curtain and see what's working for their marketing, overcoming struggles, practical knowledge, book choices, and relationship advice. Join me on any podcast app on your phone or visit adoctorsperspective.net for the show notes pages and free resources. I want you to have an abundant home life as well as a thriving practice. So come on, take a listen.
To learn more, visit x10therapy.com, 1-855-910-5633. Just a reminder, it's a huge help if you subscribe to, rate, and review our podcast. It helps people find us.
X10, back to full strength.